Thanks for joining us today. Welcome to the Center for State's video series on the 7 essential functions for intervention selection, design, and adaptation. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. Before starting this series, have you read the Intervention Selection, Design, and Adaptation brief and completed the first section of the Intervention Selection Workbook? If not, we recommend you take some time to complete these steps and then return here to where you left off. Before we begin, we'd like you to take a few minutes to consider your own experience identifying and selecting an intervention to address a problem or need. Have you ever needed to solve a problem or fill a need and were not sure what solution would work best? How did you decide? How did you know that your choice was the best match for the problem or need? Can you think of a time when you thought you had a solution for a problem or need, but were not sure it would work exactly the way you needed it to? How did you adapt so that the solution would be a better fit? Use your intervention selection workbook to write down your answers to these questions. Remember, you can pause this video at any time to record your thoughts and refer to them as you complete all 8 videos in the series. The terms well-defined intervention, evidence-supported intervention, and evidence-based practice all play an important role in selecting, designing, or adapting an intervention. Let's take a few minutes to talk about each in a little more detail. For an intervention to be usable or transferable, it must be well-defined, with enough information and guidance for administrators, supervisors, and frontline workers to understand it, implement it, and observe it. Research suggests 4 key criteria that well-defined interventions have in common: a clear description of the intervention and the intended target population, core components that define the essence of the program and represent the key building blocks leading to positive outcomes. Core components are what make the intervention work. Well-defined core components help agencies see where they might be able to adapt, expand, and monitor a specific intervention. Operational definitions are the specific actions and behaviors required to carry out the core components of the intervention. And practical performance assessments help define how to monitor the intervention. Together, these criteria contribute to making an intervention operationalized and make it easier to assess whether it is a good fit for a specific problem or need. In this series of briefs, the term evidence-supported intervention, or ESI, describes well-defined policies, programs, and services that have shown the potential, through rigorous evaluation, to improve outcomes for children and families. Depending on the amount of research evidence, ESIs fall along a continuum of effectiveness, and when closely replicated with similar populations, are expected to produce similar outcomes. A well-supported intervention will rate highly on both effectiveness and strength of evidence. Evidence-based practice, or EBP, refers to the everyday work of an evidence-supported intervention in a way that takes into account the best available research evidence, practice expertise, and meaningfully considers the values and culture of the family and community members from their perspective. Evidence-based practice is reliant on successfully implemented and evaluated evidence-supported interventions. 4 additional concepts are central to intervention selection, adaptation, and design. Fidelity, the degree to which interventions are implemented as intended by their developers and core components are maintained. Replication, copying or reproducing of an intervention in the same way as it was originally designed. Adaptation, making changes to an intervention from its original form to respond to the needs of the population being served or the agency's context. And design, developing a new intervention, including specifying its core components and the necessary features and structures to achieve desired outcomes. In addition to reviewing the evidence that supports an intervention, teams can also consider fit and feasibility to select the best match for their agency's capacity and community needs. Fit refers to the match between the components of an intervention and the organization wanting to implement it. An intervention that has been successful in one agency may not always align with another agency's priorities, operating structure, contracting arrangements, or worker norms. Additionally, the intervention may not be appropriate for the community's demographics or the target population's expressed values. Feasibility is whether an agency has the capacity or could build the capacity to implement and sustain an intervention. Feasibility may require looking at various aspects of organizational capacity, including the financial or staff resources available to plan and implement the intervention, infrastructure to support service delivery, needed knowledge and skills, agency culture, and system partnerships. Selecting, designing, or adapting an intervention is a complex effort, and there are some common challenges that implementation teams face. Some agency problems are straightforward or technical in nature and can be solved with clear policy, procedure, or practice changes. Other problems may be more adaptive in nature, meaning the solution may not be as clear or straightforward and may require changes in values or aspects of culture for the problem to be solved. Adaptive problems take time and often need innovative solutions that address multiple areas. In an ideal world, teams have access to interventions that are already proven to be effective, address a similar problem, and serve a similar population as theirs. In reality, identifying an evidence-supported intervention that directly matches a team's need is not always possible. When teams hear about successful programs or interventions, they must consider the fit between the intervention and the agency's needs, its setting, the population served, and the agency's ability to implement it effectively before replicating it. Additionally, in order to replicate and evaluate an intervention, there must be well-defined core components and a common set of observable behaviors. Without a defined standard, it is hard for teams to identify whether an intervention will meet their need. Coordinating multiple improvement efforts, often with competing timelines, is challenging. While it might seem natural to try and fix a problem or address a need immediately, taking the time to find the best solution can prevent wasting time and resources on interventions that may not address their needs or be sustainable. In this series of videos, we will discuss how teams can work through 7 essential functions to select, design, or adapt interventions that are effective and sustainable. The Intervention Selection and Adaptation Design Brief is intended to help child welfare agency leaders, managers, and stakeholders assess and select the best possible intervention to address the agency's specific problems. It does this by providing step-by-step guidance to research and assess possible solutions, and then select or adapt an existing intervention or design an entirely new one to meet agency needs. Intervention selection, adaptation, and design is broken down into 7 essential functions or tasks. 1. Research possible intervention options. 2. Assess evidence, fit, and feasibility of possible interventions. 3. Determine whether interventions are well-defined or usable, transferable. 4. Decide to replicate or adapt an existing intervention or design a new one. 5. Define the intervention. 6. Develop a proposal. And 7. Further define and operationalize the intervention as needed. In this module, we will kick off our conversation about intervention selection by looking at number 1, Research possible intervention options. Teams should take the time to adequately research as many possible solutions that will address the agency's problem or unmet need. Researching as comprehensively as feasible will give the team options to consider and perhaps allow them to find an intervention that will be a good fit without too much adaptation. Researching potential solutions also gives teams an opportunity to find out whether interventions have been used by other agencies in similar situations and what kind of result may have been achieved. To select the best possible intervention, teams should reflect on the work so far in the change and implementation process, including the identified root cause or causes of the problem or unmet need, the theory of change they have developed, including the strategies and actions that have been identified to reach the long-term objective, and the target population they are hoping to impact. Teams should look for an array of possible solutions from a variety of sources. Potential solutions might come from evidence-supported interventions, common elements of ESIs, well-defined interventions, and promising practices. Potential sources of these solutions might include directories and clearinghouses, including the Child Welfare Information Gateway and the Capacity Building Center for States, as well as studies, reports, and online articles, program developers and experts, or peers and partner agencies. Although it can be challenging for teams to find ESIs that are both feasible and a perfect fit, a good starting point is looking for evidence-supported interventions with strong research and supporting practice evidence. Teams can then review these ESIs for common elements, shared strategies, or techniques that could be used as building blocks of an adapted intervention or the foundation of an entirely new one. Common elements can help to identify best practices with target populations and are often more digestible and teachable in comparison to a complicated manual for a full intervention. Some examples of common elements in child welfare service areas include education about services, goal setting, and appointment reminders to fully support family engagement in mental health services, or family-centered case planning and comprehensive assessments of family strengths and needs during in-home service provision. One drawback to this approach is that there is limited evidence for the effectiveness of individual elements within an intervention, and the support for this approach relies on the existence of multiple ESIs related to a single problem. Teams should review additional literature on promising practices and programs related to their problem areas and needs, including well-defined interventions that may not be rigorously tested, or individual promising practices with target populations that can be used to build a solid theory about a new program design. For example, while there may be limited ESIs for children in long-term foster care, agencies designing interventions to promote permanency can draw from a strong body of literature that points to the importance of preserving relationships and addressing trauma. Teams can learn a lot about possible interventions by talking with program developers, program experts, and other agency leaders or managers with experience in implementing a selected intervention or a component. Their experiences and lessons learned can provide insight into the benefits and challenges of possible interventions, the appropriateness for different populations, replication history and considerations, core components, recommended implementation supports, and the costs, or even other considerations that might help an agency to assess. With the limited supply of evidence-supported off-the-shelf solutions, there are a few questions teams should consider as they research potential interventions. What sources are available to support identification of potential interventions? Are there easy-to-identify interventions that align with the theory of change and desired outcomes? Are there ESIs to consider? If research and evaluation findings are not readily available, what other evidence exists? Who are experts on these types of interventions that may be able to provide advice? What information have experts shared about possible interventions? Answering these questions together as a team can help to comprehensively research the potential solutions to the identified problem or unmet need, and increase the likelihood that the team will have enough options to consider as they begin to assess fit and feasibility. Let's take a moment to check in on what you've learned about researching possible intervention options. Why do teams research possible intervention options? To locate as many adequate solutions as possible and find out whether they've been used with success. How do teams research possible intervention options? By looking for a wide variety of potential options from a wide variety of sources, considering common elements, and contacting experts and peers. What can help teams to research possible intervention options? By looking into the different sources available, identifying ESIs when available, looking at all supporting evidence, and talking to experts and peers. Now take this a step further by reviewing the reflection questions and practice exercise for research possible intervention options in your intervention selection workbook to connect what you've learned to your own experience. Up next is assess evidence, fit, and feasibility of possible interventions, the second function in intervention selection and adaptation design for change and implementation.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.